Hello everyone, my name is Mohammed Abu and this is the annotated bibliography for Module 6 readings. The readings are Chapter 7, CHIM in Textbook, Human Factors and the Ergonomics of Health Information Technology Implementation, and Chapter 11, Textbook Interaction Design Beyond Human-Computer Interaction for Physicians. In this chapter, the author explores the adoption of health information technology and how the way it either helps or hinders care is related to the design of the systems and the human factors and ergonomics of technology implementation. The chapter indicates that how human factors and ergonomics practitioners and science are in a unique position to contribute to the work on health information technology usability. The authors also explored 4 areas in health in this chapter. They are the computer provider order entry, barcode medication administration, clinical decision-making system, and consumer health information technology. First, the author discussed the computer provider order entry, which refers to a variety of computer-based systems that share the common features of automating the medication ordering process and that ensure standardized, legible, and complete orders. The authors review academic evidence which reveals the greatest benefits result not from the computer provided order entry alone, but from the systems that are integrated with decision support functionality. The authors report that the debate whether the effects of the computer provided order entry are positive or negative. Nevertheless, two things seem clear. Ordering errors can be averted with computer provided order entry. Second, computer provided order entry can lead to unintended consequences on poor communication and coordination. Another system discussed is the barcode medication administration. The authors review research that demonstrate the importance of the system in reducing the adult patient medication errors at the medication administration stage, and how the paper design and implementation of the system help to ensure the 5 rights of medication administration: right medication, right patient, right dose, right route, right time, and to ensure complete and accurate implementation of the administration process. Although the author reports how barcode medication administration does support some nurse needs in ways that previously paper systems couldn't, however, they discuss the human factors and ergonomics challenge of the barcode medical administration systems. They report how the system poorly supports nurses' cognitive and physical performance needs and leads to workarounds and protocol violation, and this is in turn may increase the risk of patient safety events, where in other cases poor design prevents nurses from doing their work at all. The authors report that much more work is needed to design the barcode medical administration systems to adequately support the complex cognitive work of nurses. The third system discussed are the clinical decision-making systems, which are supposed to provide clinicians or patients with computerized clinical information at the appropriate time and in an understandable format. Clinical decision-making systems are typically designed to aid decision-making for prevention, screening, diagnosis, treatment, drug dosing, test ordering, and chronic disease management. The authors reports how clinical decision-making hasn't enjoyed widespread success. Rates of ignoring or overriding the clinical decision-making systems are very high, with some reports as high as 90%. The authors report that there are also many human factors in the ergonomics design and implementation reasons. Some of them relate to simple usability improvements, but the others are more complicated macroergonomics issues related to workflow integration. The design for appropriate reliance and compliance given highly variable and unpredictable cognitive work. These factors include not having or inappropriate data entered prior to seeing the patient, clinicians not logging into the computer systems in the first place, clinicians not being trained how to incorporate computers into patient visits, brittle clinical decision systems algorithm that didn't match patient realities, physical layouts that reduce the likelihood of usage, electronic health records architectures that inhibited easy integration of clinical decision systems. The last system the authors explored are the consumer health information technologies, which refer to patient-focused interactive web or technology-mediated applications. The health information technologies support patient care at home by extending services and resources to patients who have limited or no access to healthcare. They are designed to improve information access and exchange, enhance decision making, maintain records or essential health parameters, provide social and emotional support, and facilitate behavior changes for health issues. The authors demonstrated through literature how the systems are reported as not user-friendly, of poor usability, and do not coordinate with the changes in physical and cognitive characteristics of patient users due to chronic disabling conditions or aging, which is a major issue in health innovation design. The authors demonstrate the human challenge to consumer health information technologies design and the implementation as the patient's computer skills and confidence level in their ability to use technology. Also, other significant human factors challenge for the design and the implementation of the computer health information technologies range from the design of the software or device to the unique needs of the chronically ill and elderly, to the unique physical environment of individuals' homes. Authors report how evidence demonstrates that applications of user-centered design approaches can increase the likelihood of consumer health information technologies acceptance and use. They explore the aspects of design that promote usefulness and usability, such as consumer health information technologies must be designed with systems application are in consonance with the patient's needs. The technology should improve patients' ability to manage their disease, save them time managing their disease, and make them more effective at managing their disease. Achieving these goals will likely require systematic usability evaluation and cognitive analysis, careful attention to human factor engineering and cognitive engineering principles. Chapter 11 from course text introduction design beyond human-computer interaction, design, prototyping, and construction. Prototyping definition. Prototype is one manifestation of design that allows stakeholders to interact with it and to explore its suitability. The importance of prototyping. Prototypes are useful when discussing or evaluating ideas with stakeholders. Prototypes also answer questions and support designers in choosing between alternatives. In this chapter, the authors define two types of prototyping: low-fidelity prototyping and high-fidelity prototyping. The low-fidelity prototyping doesn't look very much like the final product and doesn't provide the same functionality, while the high-fidelity prototyping looks like the final product and or provides more functionality. The intention of prototyping is to produce something quickly to test an aspect of the product, so it will not be free of compromises. Two types identified: horizontal prototyping, that providing a wide range of functions but with little details; vertical prototyping, that provide a lot of details from only a few functions. The author identified four methods for low fidelity prototyping: storyboarding, sketching, prototyping with index cards, wizards of Oz. Three elements to develop an initial conceptual model: interface metaphors, combine familiar knowledge with new knowledge in a way that will help the user to understand the product; interaction styles, introduce four different types of interaction: instructing, converging, manipulating, and exploring. Interface styles: shareable interface, tangible interface, augmented, and mixed reality. The author identified two aspects of design: conceptual design and concrete design. Conceptual design and concrete design are closely related. The difference between them is rather a matter of changing emphasis. During design, conceptual issues will sometimes be highlighted, and the other times concrete details will be stressed. Two ways to generating prototypes: producing a storyboard from a scenario, and card-based prototype from a use case. To define a scenario: scenarios are informal stories about user, tasks, and activities. The authors also identified two kinds of resources to support development: physical computing kits. Physical computing is concerned with how to build and code prototypes and device using electronics. The second one is software development kits. It's a package of programming tools and components that supports the development of applications for a specific platform. Thank you.